Facilitation involves a range of actions, such as removing the hurdles, challenges which patients face as they seek their health services, raising awareness on their medical conditions, treatment path, as well as also encouraging them that they should be involved in self-care.
Facilitating helps the people to deal with the processes and to reach the agreement or solution they would like to have in place. It's not always like being directly involved in the processes, but somehow either from side or from lobbying and advocacy, helping the things happen with the intention of pushing everything in a way that it meets your expectations and your wished results.
From our point of view, it means involving patients in what we do, giving them opportunities to take part in the work that we do. So whether it be policy, also in the education that we do with the health professionals, the sessions with the medical trainees and the nurses, also with the research. There have been several patients who've taken part in these large research projects.
Facilitation means creating spaces where patients' voices can be heard, fostering dialogue among all stakeholders, and building bridges between different perspectives to solve systematic challenges.
We try to facilitate for the patient to have more understanding and more knowledge for the self-care and aware of the disease in order to facilitate them to get access to healthcare service.
When you think about facilitation, it's really helping patient organizations on the ground to help facilitate the work that we're doing, to keep the patient communities that we're representing up to date and knowledgeable about what's going on, so that they have the tools then to help their community and facilitate their mission and the work that they do.
Is about working together. And having been part of the network and also IAPO and other umbrella organizations, I think it really makes sense, this facilitation of working together, because it helps the growth of the organizations, because through the exchange between organizations, we learn from each other. One of my mottos is 1 + 1 is more than 2.
Facilitation means making things easy or easier. So when a person is facilitating, they are making things easier for the other person. And so IAPO is making things easier for the patient.
It is about facilitating resources and capacity building to strengthen the work we do as organizations on behalf of patients. Facilitation is also about creating a community of support in which strategic connections can be made with other stakeholders.
One of the big examples that I can share is that when IFPA, the International Federation of Psoriasis Association, is pushing for the global psoriasis resolution, IAPO has been a strong partner. We've learned from IAPO, and IAPO also helped connect us with the right people to talk with. And 10 years ago, it was approved.
With organizations like IAPO supporting that and providing that layer of education and understanding and facilitation, that really helps to drive things forward for the smaller patient organizations on the ground.
Is about providing a platform on which to bring people together. It's helping us to pool our resources, our experiences, our skills, and to be able to share them with each other to build a stronger movement of patient organizations. And I think that IAPO is a great facilitator. They do this job very well.